Hi guys, this is me Gayatri Prakash and welcome to my page. എല്ലാവർക്കും എൻ്റെ പേജിലോട്ട് സ്വാഗതം. So today I would like to discuss with you all about December 3rd, 2022 OET exam in which OET writing. Okay, so what was the writing task? It was a simple writing task because we are writing a letter to a physiotherapist. So far we have received a letters like writing a letter to the patient's own GP or writing a letter to a nursing home service for the short-term or long-term nursing care. And this is the very first time in this year we are receiving a letter, writing a letter to a physiotherapist. Okay. It was not a difficult letter. It was a quite easy letter as per my students. They have said to me that it was a quite simple and very easy letter, but there are important points that which has to be notified to the physiotherapy when you are writing this letter. Okay, so let's move on to the case note. So what was the case note? Patient name Mrs. Elizabeth Hills. She is 77 years old. Actually, she is living on her own and she is already suffering with osteoarthritis, and also a patient is patient is having a periodic problem of taking the medications, and also patient is not good concentration on her own conditions. She is kind of a fragile lady who is having a history of fall, and also she has a high risk of fall. And November 2021, patient got admitted in the hospital because of the right wrist fracture which happened at home following a fall. And after she reached hospital, she has received conservative treatment which includes plaster cast, and cast was applied, and the affected part of the wrist was supported by the cast, and also they have provided enough medications to treat her conditions. Later on, she has been initiated with the physiotherapy programs to improve her recovery process and for the muscle strengthening. However, the patient was non-compliant with her physiotherapy regimens. At the time of discharge, patient was advised to take a DEXA scan after 2 months interval. So patient came back to the hospital after getting discharged. Patient came back to the hospital after 2 months to do the DEXA scan. Unfortunately, she was found to have osteoporosis. Thereby, doctor said to her, it is a good idea to take adequate rest. At the same time, she has to continue the exercise programs and the conservative management for the osteoporosis along with the medication regimen. Unfortunately, Mrs. Hills refused and reluctant to continue the physiotherapy regimen. Thereby, she revisited the hospital on 8th of January 2022 with the complaints of increased pain and weakness with a high risk of fall. Thereby, a nurse who is looking after her writing a letter to the physiotherapist to provide her a comprehensive physiotherapy programs to enhance her muscle strengthening, as well as to prevent the future risk of fall. Along with that, the nurse is explaining to her to take the importance of medications. So this is a very simple letter. So the patient is first time getting admission in the hospital due to the right wrist fracture following a fall at home, and she is receiving a conservative management, and the affected part is supported by the cast. And also she is advised to continue the physiotherapy programs. Unfortunately, the patient is reluctant to continue and non-compliant with the physiotherapy regimen after the discharge. As a result of that, she is suffering with the weakness and the pain and poor muscle strengthening, and back to the clinic on 8th of January 2022 for the further treatment and management. So meantime, at the time of discharge, patient was advised to take the DEXA scan in 2 months interval. So patient has undergone for the DEXA scan, and it revealed that she has osteoporosis. So again, the same advice was given to the patient. So it is good to start with the physiotherapy regimen and the conservative management. This will help you to overcome the problem, and it will be like a kind of a maintenance programs. However, the patient is still reluctant to go ahead with the physiotherapy program. As a result of that, she is affected with the poor muscle strength, and her recovery is not getting well. The right wrist recovery is not getting well. So that we are referring the patient to the physiotherapist for the proper physiotherapy exercise regimen, and also to encourage her and to help her to know the importance of doing exercise for her condition. So this is a very simple letter, right? So now we'll see how we can write a letter now. Okay, so as usual, we are writing a date or address, either anyone we are writing on the top of the paper. So here we are writing the letter on 8th of January 2022 because which was the last visit by a patient to the clinic. Okay, so that day only, after seeing her condition, we are writing this letter to the physiotherapist. And next thing, as if you write the address first, then you can go for the date, or if you write the date first, then you can go for the address, addressing this patient to the physiotherapist. Okay, and second thing is like salutations, and then we are coming to the point of reference. So in the reference you are writing Mrs. Elizabeth Hills, and her age is 77 years old. Okay, now coming to the point of introduction. So here mainly we have to write two conditions of the patient, because one condition which has been there for almost 3 months, we could say, from the date of admission to from the day until the today's date. So she has been in recovering process of the right wrist fracture. And the second thing is which has been recently diagnosed, which is osteoporosis by doing the DEXA scan. Okay, so these two things have to be mentioned in our introduction, which is important also. So how in that situation, how we can write these two things? So you can start as usual with the names, like rather than writing the purpose of writing this letter, because it is like it's a kind of a format, right? So you can just go start with the name of the patient. So Mrs. Elizabeth Hills, who is recovering from right wrist fracture and has osteoporosis. So two things you can mention. Either you can write who has osteoporosis and are recovering from right wrist fracture, full stop. She requires your comprehensive physiotherapy program to enhance her muscle strengthening. That's it. So to enhance her muscle strengthening. So you can write like this: Mrs. Elizabeth Hills, who has who has osteoporosis and recovering from right wrist fracture, full stop. She requires your comprehensive physiotherapy program to enhance muscle strength. That's it. It's a very simple way. So because the physiotherapy can provide her adequate physiotherapy exercise programs to enhance her muscle strength as well as to overcome the complication of osteoporosis. Okay. And also we can say that to prevent the future risk of fall. Okay, now coming to the point of present medical history. So here we always have a doubt. Either should I start with the today's history, nor should I write the past medical history, and then I have to go for the today's history. So here the main thing is like it is better to start with the past medical history. Why I mean to say the past medical history is relevant to your current situation. So it is a good idea to start always the past medical history. If your past medical history has the relevant to the current condition, it is good to start always with the past medical history, because you will have the continuity of the matter of the letter. So the patient condition can be explained very well. Who is the reader of your letter can understand, okay, this was the thing happened first, and followed by this happened, and followed by this happened. So the continuity will not miss it. So it is better to start the past medical history. So what is the past medical history in this case note, which means when she got admitted in the November 2021, right? So that has to be started first, and then later on you are explaining today's history, so the continuity will come. So we will not miss the information, and there will be the connection of the past and the present. Okay, so how we can start? You can start as usual with the second name of the patient. So what is her second name? Mrs. Hill. So Mrs. Hill was admitted on November 2021 due to right wrist fracture following a fall at home. Therefore her affected part was supported by cast, and then prescribed medications for wound healing, full and pain, that you can write it. Next thing you are writing that during hospitalization she has been initiated with the physiotherapy programs, and it has to be continued after the discharge. Apart from that, she was advised for DEXA scan in 2 months interval after the discharge, full stop. Then you can write later DEXA scan. Then you can write it. Her DEXA scan revealed osteoporosis. Therefore, she was advised to continue the same treatment along with the physiotherapy programs. However, the patient was reluctant to continue the physiotherapy programs. Like that you are writing. So this is the one passage that you have finished. Next one you are starting with today. Today Mrs. Hills represented or revisited, like that anything you can write. So revisited with weakness, and along with the weakness, increased pain, along with the high risk of fall. So what we have done, therefore she was advised to continue the exercise program. However, she is still reluctant to continue the exercise programs. Thereby you are writing the patient's recommendation paragraph. So in the recommendation paragraph, you are writing for the physiotherapist. How will you write for the physiotherapist? It will be highly beneficial if you could take over Miss Hills and provide her a comprehensive physiotherapy to enhance the muscle strength and also to prevent the future risk of fall as well as osteoporosis complications. So like that. So what are the other discharge advices might we have given which is not related to the physiotherapy? It is better not to write, because physiotherapy will not give that medications, will not do the dressing. So physiotherapy is a person who can help the patient by providing the physiotherapy programs, exercise programs to improve the mobility or improve the muscle strengthening. So here remaining other points that which is not related to the physiotherapy, it's better not to write. Only with what is related to the physiotherapy, that is a better idea to write it in your discharge advice. Okay, so introduction, like we are just writing Mrs. Elizabeth Hills, who has osteoporosis and recovering from right straight fracture, full stop. She requires or she needs your comprehensive physiotherapy program to enhance her muscle strength. And coming to the present medical history paragraph, we are starting from Miss Hill was admitted on November 2022 due to right wrist fracture following a fall at home, full stop. Therefore, her affected part was supported by plaster of cast and provided medication to improve her healing process as well as pain, full stop. As well as reduce the pain, full stop. Then we are just telling her during hospitalization she has been initiated with a physiotherapy program that has to be continued after the discharge. At the time of discharge, she was advised to do DEXA scan in 2 months interval, full stop. Then her DEXA scan revealed, unfortunately, her DEXA scan revealed osteoporosis. Thereby, she was advised to continue the same treatment along with the physiotherapy. However, patient reluctant to continue the physiotherapy. Today, she revisited to the clinic with increased pain and poor wound healing, increased pain, weakness, along with high risk of fall. Therefore, she was advised to continue the physiotherapy program to relieve from the future risk of fall as well as the complication of osteoporosis and enhance the muscle strengthening. Thereby, we are writing the recommendation. So, it would be highly beneficial if you could take over Miss Hills and provide her a comprehensive physiotherapy to enhance her muscle strengthening as well as to prevent the future risk of fall. Then please contact me for further details. Yours sincerely, if their name has given, if not given, yours faithfully, and you are writing your position. So it was a very simple letter. I hope you all have done, whomever attended the exam, they all have done in a very good way. Hope for the best result, finger crossed. And if anyone wants to join in our class, online classes, our number has given in the description. You can contact us at any time. You can join in our class. We have 10 days, 20 days, 50 days, 40 days and 30 days. And we have a beginners batch also going on. So you can call us at any time. Until then, bye-bye.